As you have all heard, the Cyprus Thalassemia Association is one of the first, if not the first, patients association with a special interest in thalassemia. And today we're going to see together the past, the present, and the future of thalassemia through the eyes of a patient, as a part of a patient's organization. First, allow me to thank the Swedish Chronic Blood Disease Patient Association and Thalassemia International Federation for the opportunity to be among so many wonderful people, friends, and as we always say, family from all around Europe. Events like the capacity building today are a way of strengthening patient associations, carrying forward, and at the same time receiving experience and knowledge. Having this in mind, I will try in the next 15 minutes to present the past, the present, and the future of thalassemia with an example from Cyprus as a part of the Cyprus Thalassemia Association. Being a person with thalassemia at my age, as Laurie said before, in a different era, in an era where thalassemia wasn't still known, the medical community didn't know what it was facing, and our parents most certainly didn't know how the future would be for their kids. So this is young Miltos at the age of 1 with my mother. This is a photo of me for the thalassemia clinic file. At the time, they were taking a photo of us to recognize us and identify us with the medical record they had. So this is the photo of me the first time we know, at the period we know that I had thalassemia with my mother. At this time, we were feeling uncertainty and fear for the future, us and our parents. The blood adequacy and safety, the reciprocal focal blood donation, and of course not compensatory. And we had some circumstances we were facing that were too difficult. After some years that we started iron chelation, we had single death shots. I believe that some people in this room can remember the feeling still at this age of the single shot, the pain, the injections, the blood transfusions, all this physical pain, and the burden on all of our activities. Except of the actual pain and the feeling and the problems we had some impact on our social life, on our school life. We had bullying at school. It wasn't a unique event to be bullied at school and in Cyprus and all over the world. At that era, we were different. We were something different. So the other kids, always had something to say about us. And of course, we had less study and free time. This was something we have to deal with. Later on, we were facing problems in our romantic or family relationships. We have a lot of stories to tell, but it's not the time to do that, maybe at the break. Now, our parents understood that they could not help their kids unless they joined forces. So, in the beginning, it started with parents' gatherings. We see here from the clips on the newspapers the announcement of the first gatherings of our parents in Cyprus and the general assemblies that followed the next years. Our parents joined forces to try and find ways to deal with the disease, deal with the social impact, deal with the blood shortage, and all this we had to face in the early years. Cyprus is unique for thalassemia, and I'm not trying to separates Cyprus from other countries in the region, but the impact for Cyprus of thalassemia is huge. This is the thalassemia trait density in Europe. As you see the colors, Cyprus is the most red spot on the map. We have the most dense trait percentage in Europe. 14% of the population is a carrier. The numbers were and are huge for the health system to deal with. Imagine that 1 in 50 couples had a possibility of giving birth to a thalassemia patient. Another small data that's very characteristic of the situation is that 44% of the expenses for all the medicine in Cyprus in 1983 were for deaths. Almost the half of the budget for the medicines in Cyprus was for deaths. So our parents had to do something and get organized. If there wasn't a prevention scheme in place, the numbers of thalassemia patients in Cyprus were to explode. Imagine that Cyprus is an island of less than 1 million population. Imagine if you have 4,000 or 5,000 of thalassemia major patients in that small island. The burden is huge. So Cyprus Thalassemia Association had to act in a really decisive way. A few years later, thalassemia was announced as a national disease, and something that we still use on our talks and our interventions. We face thalassemia in Cyprus like our national disease. Major problems and major issues that we have to deal with: the blood adequacy and safety, founding blood coordination and information committee in collaboration with doctors and nurses. We see here inauguration of the Limassol Blood Bank in 1983, continuous enlightenment campaigns for blood donation and organizing blood donations all over Cyprus. This was something our parents were doing every few days, because you understand that we all have this memory of our parents trying to find blood in our early years. The iron chelation and therapy. Cyprus Thalassemia Association had to constantly support the thalassemia clinics and blood donation with equipment. Here we see some of the first infusion pumps for Desferal. I'm sure most of you can recognize the Smith pump we used to carry around in these years. Cyprus Thalassemia Association secured infusion pumps for every patient in Cyprus. The establishment of thalassemia clinics, exerting influence and pressure on the state to establish thalassemia clinics in every city. With these huge numbers that we had in Cyprus, there has to be a clinic close to the patients in every city. So we see here at the first days of the thalassemia clinic in Larnaca. This is a paper. This is a clip from the newspaper in 1978. And of course, one of the biggest achievements of the Thalassemia Association at the time was the creation of the National Thalassemia Center in Nicosia. And this is special because this is a collaboration between 3 pillars of the Cyprus society: the church, the state, and the association. Mr. Panos Englesos, which was the first president of Cyprus Thalassemia Association, with his team, managed to accomplish a huge achievement by making the National Thalassemia Center. Today, as we were going to see later, we're on a stage of renovating and building a new Thalassemia Center on a new floor above the building. The prevention program. From the graph you saw before, if there wasn't a prevention program in place, the numbers would be not difficult, but impossible to handle for the national health system. So 1972 was a milestone year for Cyprus as the National Thalassemia Prevention Program was launched in the first diagnostic laboratory established as part of hematology laboratory at the hospital. The prenatal methods, prenatal methods established in Cyprus in 1981. And in order to strengthen the prevention program, the use of marriage certificate is introduced in collaboration with the state and the church. As Androulla stated before, the church was a major collaborator with Thalassemia Association to achieve the results we have. Here we see a graph of the new births in Cyprus and the several marks on this story. As you can see, the records we have for the years before 1970, for example, we can't trust them because people were giving birth to kids with thalassemia, but not, we didn't know that they were born. Kids were born and die and didn't know that they had thalassemia. We see the start of the recording of the population, and then the impact that had some intervention. For example, the population screening starting in 1973 saw a stabilization of these numbers, and of course the prenatal diagnosis in 1981, and the introduction of the premarital certificate by the church were marks in history that had an impact on the number of thalassemics born. My sister, for example, at my family, I'm born in 1975. My parents, when I was born, didn't proceed and have another kid because they couldn't know if he was going to be born thalassemic or not. So after 1981, that the prenatal diagnosis was established in Cyprus, they were able to proceed and have a second kid. Most of our families dealt with that. Of course, the social integration and job security. You can imagine kids with thalassemia trying to find a job. Here we have something from a newspaper in 1984, which says in Greek, young people with thalassemia can't find a job. Of course, constant interventions to ensure that people with thalassemia will have decent opportunities for employment in the public or in the private sector. Some policies were established at that period. For example, 10% of the people hired for the public sector would be from groups of people with diseases, or for example, to students going for public universities. 10% could be of these groups. But now we're getting older, and getting older is something to be happy about. We're happy we're getting older, but this comes with multiple comorbidities, with work stress and insecurity, with chronic pain, and of course, all this has to be dealt with, and the association has a big role to play in that. In the next years, we, the patients, started to get involved in the thalassemia, in the leadership of the Cyprus Thalassemia Association. The increase of the patient's age, comorbidities, chronic pain, work stress, and insecurity offer different challenges as the time passes by. The need for specialized programs and services by the association itself is now imperative. The pillars of the work of the association now is different from the past. Now we are aiming to form health policies that have to do with with thalassemia and services. National Thalassemia Committee and the adoption by the state of the National Strategy for Thalassemia and Other Hemoglobinuropathies, which was voted by the Minister Council a few months ago, based on 5 pillars: population control and prevention, clinical management, social support and welfare, research promotion, and structure and organization of the thalassemia clinics and services. The health system itself, the general health system, was started in Cyprus in 2019. This gave a whole different way of services to thalassemia people and the other patients. It brought free access to every chelation available. Even in Cyprus, we had problem with access to some of the chelators. Now, thanks to the new health system, this is solved. We are pushing to have the introduction of innovative medicines, quality medical consumables, access to the over-the-counter medicines, and all this is in a very new environment. But the association is trying to establish that all these services from the national health system will be offered to the people with thalassemia. Strengthening thalassemia clinics. As always, as in the past, we keep supporting the thalassemia clinics. After negotiations with the state, there was a decision for a new thalassemia clinic, as I said before, in Nicosia, and now we are under discussions with the National Hospital Service to how this will be implemented, and a new clinic in Paphos. The exertion of influence and pressure on the state to staff the thalassemia clinics with additional much-needed specialists and nurses. And of course, supporting thalassemia clinics in various ways, donating the needed equipment, offering free Wi-Fi, cable TV, coffee, and other services to patients during their time at the thalassemia clinic. On the social welfare framework by the state, interventions were made here as well, and we had some positive decisions. Since 2018, a travel allowance is given to every thalassemia-dependent, transfusion-dependent thalassemic person relevant to place of living. Since December 2020, every person with transfusion-dependent thalassemia at the age of 50, which is with 15 years of social insurance, is receiving a special tax-free allowance equal to what his or her pension would be at the time until the formal retirement age. Since 2019, there is a recruitment plan for people with chronic diseases to the public and the private sector. And of course, negotiations are in place to establish support to people with thalassemia with no other income or support. This is a photo of our association, of the leadership of the association, at a meeting with the minister, of the late Minister of Labour, Welfare and Social Insurance in January of 2021. As an association, we have support programs for our patients. We have a psychology support program. We have a physiotherapy and musculoskeletal intervention and prevention program. We have 6 psychologists and 6 physiotherapists in the several regions of Cyprus, offering services to people with thalassemia. We organize conferences, seminars, and workshops. We have a card member discount program with several shops. We offer specific support interventions, economic or other, where needed. And we have a comprehensive web page with information for the public and guidance for the people with thalassemia for their rights, our programs, our support programs, and of course access to educational material. It's www.thalassemia.cy. Here you can see a small number of photos with our meetings and events, with ministers, parliament members, officials, and others in Cyprus. This is constant. This is something that takes a lot of time. And as Laurie said before, this is something that you have to do in order to achieve the support and the changes you want for your patients. So priorities change. In the past, we had the blood adequacy and safety, we had the iron chelation, the establishment of thalassemia clinics, the prevention, the social integration, and the job security. Now, we had to deal with health policies and health system. We had blood adequacy, of course, and safety, which is something I think that we always take care and strengthening thalassemia centers and social welfare framework by the state, and the support of the association for the patients. For the future, we have to focus on the quality of services. We have to ensure that there are state-organized support programs. We have to lift the responsibility of supporting our patients from the associations and giving it to the state. I'm living for the day that an association, a patient association, won't have anything to do. This is the day I'm dreaming. And of course, we're getting older and older. We need multidisciplinary teams for thalassemia. This is something that we come across the recent years, and I think that that's something we have to focus in the future. The individualized treatments and interventions. Individualized medicine is the future, not only for thalassemia, but for every other disease. The access to new and innovative medicines and treatments, a complete social welfare framework for every patient, and why not, we still can hope for a gene therapy for older ages. What's the role of Cyprus Thalassemia Association? I'm sorry, but the computer didn't follow my animation. So, health policies and therapy. Monitoring and evaluating the situation. Continuous advocacy towards improving patient with thalassemia rights and developing and enhancing auxiliary programs. The important thing to remember is that thalassemia is a big family, either in the same clinic, country, or even around the world. We share emotions and feelings that can hardly be understood by other people, and we have to keep fighting for us and for the younger brothers and sisters of our family. Thank you so much.